Brightside here on Facebook Live for just a few seconds. You can check out the beautiful Dr. Lynette Yap, and she is in studio today to talk to us all about eczema. There's so much that I thought I knew, and you will take us through common misconceptions. And you stated that actually eczema is a very common skin condition. People don't realize that.
Yeah.
So we are jumping on air right now. Join us there as well. Let's get loud. Jennifer Lopez here on the bright side, and we want to welcome a ray of sunshine. Your skin looks amazing. I've always had very glow skin envy of Dr. Lynette Yap. Welcome back to the studio.
Hi.
A little bit about her. She's a general practitioner with special interest in dermatology and aesthetics, trained in London, and she's part of the amazing team that I go to, NYX Professional, and you can find out more at nyxpro.com. Welcome back, Dr. Lynette. So, what have you been up to since we last saw you, girl?
I've been a very busy girl.
Doing what,
I've been doing 3 diplomas, so I'm just completing all 3 of them because all of them had their exams together.
Okay, she really felt like she needed to impress me, right? When I said, hey, what have you been busy with? She really got busy, guys. So what are these 3 diplomas? Is it related to what you are doing currently, with your interest in dermatology, aesthetics?
Yeah, so then there's one on the dermatology, diploma in clinical dermatology.
Wow.
And then a diploma in family medicine as well.
Okay.
And as well as a diploma in nutrition and diet.
That is interesting. I mean, why the last diploma?
I mean, I just felt like your diet and everything that we put into our body is actually really affecting our skin. There's also things that we can do for disease prevention and things like that.
Right.
So then I decided that I wanted to do it so that I can combine everything together.
And I guess, hearing from what you just said about how your diet plays a huge role on your health, right? And it will manifest into conditions if you don't take care of your diet. Is eczema one of those things? That's what we're talking about today. I mean, can you tell us, what is eczema? How serious is this skin condition?
So, I mean, eczema, everyone thinks that it's just that one thing, but actually it's a whole group of conditions.
Really?
There's so many kinds.
Okay.
Basically, it's just a group of conditions whereby your skin is dry, it's itchy, it's inflamed, and what we call very angry.
Yeah. Oh my gosh. I've had my bouts of eczema, which brings us to my next question. I mean, what are the causes of eczema? Is it temporary or a long-term condition? I mean, I'm seeing both sides of it. I know of friends who have had it all their lives. You know?
I mean, eczema, it's a chronic condition. It's just, how do I explain it? It's a bit like asthma.
Okay.
Whereby we have it all the time, and then sometimes it just gets really bad and you have to take more medication. They have to take their inhaler, things like that. But there are things to do to keep it under control on a day-to-day basis.
Okay.
Yeah.
You know what? We must discuss more about this because eczema really, you tell me, it's actually a very, very common skin condition, right?
Yeah. So, I mean, in infants, I think about 10 to 20% of them have eczema. As we
Really?
grow older, the number just does come down. So in adults, about 1 to 3% of adults in the world has eczema.
Okay, so we are not alone. I don't know if
Yes,
it's a good thing that we're
definitely
not
not
alone
alone.
on this, but we're going to chat more about eczema. If you have any questions, guys, send us a WhatsApp, 88550913. Share with us your comments. And I know that because it is a common problem, you might suffer from it in some way or form. You can ask Dr. Lynette your questions. And also jump on to Facebook Live with us right now. When you chime on in WhatsApp or Facebook Live, you could win for yourself a $100 Audio House voucher. So do that. Okay. Welcome back, everybody. Facebook Live here. It's the Bright Side with Dr. Lynette Yap, and we're talking all about eczema. So it's a very, very common problem. I mean, already you're seeing it. It starts from young. You mean people are born with it. Is it a genetic
That's
thing?
from young. Yes, it is a genetic thing.
Oh, yeah. So you can't really run away from it.
You can't really run away from it. It's associated with a few other genetic problems together. So like asthma, atopic rhinitis, whereby, you know, when you wake up in the morning and then you always have the runny nose.
It sounds like me. Sounds like me. So if it's genetic, and I mean, it seems like that's the basis, right, of it.
Yeah.
What can we do? I mean, what kind of treatments are there? You know, do we have to live with it? Do we have to suffer with it all our lives? How
No,
is
you
this
don't
gonna
have
play
to
out?
suffer with it.
Oh, okay,
Yeah,
okay,
so
that's
there are
good.
always ways that we can do to try and keep it at bay through our day-to-day practices.
Okay.
And then, of course, when there's an acute flare-up, so when I say that, it means like when it gets very itchy, very angry, you can't seem to get the control of it, see a doctor, and then there are multiple treatments for it.
So when do you suggest is a good time for us to like see the doctor about it?
Honestly, the first step is to get it diagnosed. Yeah.
Okay.
So that we
okay.
can tell you like what you can do at home, what you can do with your diet, like what we said,
Right.
or even like how you shower.
Also can cause eczema.
No, not it can cause, but it's more
mean,
of how to
aggravates
calm
it.
it down.
Oh, to
And
calm it down.
Yeah.
Okay.
There are some
okay.
things they do in the shower that aggravates it, and there are some
Okay.
things that you can calm it down with.
So it's okay if we suspect that we have eczema, or some kind of skin condition. Just go to your general practitioner, your GP first.
Yeah.
And then from there, try their treatment. If it's not working, then it's time to see a dermatologist who specializes in the condition.
Like when we've tried the topical creams and it's not worked, and then we kind of need to think about the more advanced techniques, like we do UV therapy.
Okay.
So you actually go into the room where they shine UV light on you, or like get injections.
Do you get a suntan at the same time while that's happening?
Unfortunately, no.
Oh, think about it. Think about it. It could be onto something. Treat eczema, get a suntan at the same time. Win-win. I don't know. I love this. This is a Facebook Live comment from Wang Aolun, and he says, "Good morning, Dr. Bright Skin."
Good
You are right
morning.
on that, Aolun. She has really gorgeous skin. Oh, definitely no eczema in sight. Definitely. I'm interested to know this because, we had a chat off air about the causes of eczema, and you mentioned some really interesting causes. You said about clothing can even be one of those. Could you share a little bit about that?
So not really a cause, but a trigger.
A trigger.
for
Yes, that's
eczema.
right.
Yeah.
Okay.
So there are multiple triggers for eczema, and everyone's trigger is different.
So what are some really people don't realize these could be possible triggers? Clothing is one of them.
Yeah, so our clothes, the synthetic wear or like wool, it actually makes it worse.
Okay.
So then if you wear cotton, bamboo, it actually makes it better.
Okay, that's really interesting to note. No wonder, like, even for children, they are going down the route of, bamboo fiber clothing and all that, because
with the tag being outside as well.
Even the tag could be a trigger for eczema.
So they put the tag outside so it doesn't irritate the skin.
That is so interesting. What are other things that you think that we can actually control to help with our, eczema? Be it acute. Acute is what you say is temporary, right? And then if it's chronic, can we just go through again about what are some things that we can do day
Well,
to day?
I think it's the most important thing, moisturizing.
So how do we do that? Do people over moisturize with the skin condition or under moisturize?
I don't think I've seen anyone over moisturize before though.
They have when the doorknobs, everything, and then there's like moisturizing handprints everywhere.
Okay, in Singapore we normally under moisturize.
Like in general, when it comes to caring for our skin.
Yes.
Is that so?
Yes.
So wait, just a side note, you get a lot of people coming in with they think of skin conditions like dry skin, but it's really just a simple case of moisturizing.
Yes.
Really?
So they're like, oh, it's really dry and everything. And I'm like, how often do you moisturize? Like, once in a while, whenever I feel dry.
When I cook and then the oil splatters on me.
I'm like, it doesn't work that way.
Oh my God, that is such an interesting point. Singaporeans, we are under moisturizing. We need to get that together. So any kind of moisturizer for a general use and also for eczema, are there different kinds that we should look at when it comes to?
I normally go for ones that has like oatmeal, has ceramide,
Why is
hyaluronic
that?
acid inside, because those are all things whereby it helps to absorb a bit more water and to have, because the whole point of of eczema is that you don't have enough of the moisture. So then this helps to bring in the moisture.
I see.
Yeah.
We have to share that on air actually in just a bit. So stay right here on 1FM for the Brightside with Dr. Lynette Yap. Oh, I love this one. And of course, made famous again with a Netflix show, Stranger Things. Running up that hill, A Deal with God. Kate Bush here on the Brightside. Good morning to you. And yes, we're in studio in talk with a good doctor. She's in, Dr. Lynette Yap. I got to share this with you guys. We had Alun on Facebook Live and he said, "Good morning, Dr. Bright Skin." I think that's going to be your nickname from now on when you come on the show, Dr. Bright Skin. I'm not going to say Dr. Lynette, Dr. Bright Skin. So we're talking all about eczema, and we've shared some really interesting points on our Facebook Live. You say that one way that we can help with the problem is moisturizing. Right?
Yes.
If you are eczema sufferer, whether it's an acute, like a temporary thing, or if it's a chronic eczema, it's just a simple case of moisturizing.
And you moisturize enough.
Moisturize. So are we a nation that under moisturizes or over moisturizes?
We're a nation that under moisturizes.
Really?
That is for sure.
You mean as in general, like skincare, we are just not taking enough care of our skin, and it's a simple case of just putting on a little bit more moisturizer? Really?
I think it's not more on the face. People normally put moisturizer on the face, but they forgot about their body.
Oh, yeah, I'm guilty of that, I'm guilty of that. Because I just make sure I wear long sleeves and nobody sees my like dry skin. So you see, just a side note, so you do see a lot of dry skin sufferers, and it was just a simple case of just slap on some moisturizer.
Yes.
And also for eczema sufferers, moisturizing is key. What kind of moisturizer should they look for?
I always look for a thick one with ceramide or oatmeal or hyaluronic acid inside.
Okay. I've got a great question here from Lorraine Yap, and she says, what kind of soap should one use for eczema skin?
Okay, so eczema skin, unfortunately, the normal kind of soap, but whereby with all the bubbles and the foam and it feels so good, it kind of leaves your skin a little bit too dry because it removes the moisture. It removes too much of the moisture on the surface.
Oh my god!
So then, for most eczema patients, I do suggest to get a soap-free soap.
Soap-free soap, okay.
There are multiple brands for that. Or what is even better is actually to go for a bath oil.
A bath oil. And
yes.
It's just, you just look for bath oil and then that's it? Or is it like a specific kind of aromatherapy oil or something?
No. So it doesn't have any aroma inside. So no fragrance. It's hypoallergenic.
Okay.
The oil is there. So everyone thinks like, oh, when I'm washing with oil, I'll get more oily.
I won't get
doesn't feel clean.
Yeah.
But honestly, it removes all the dirt and grime of the day, all your sweat, all the pollution you've accumulated.
So does this mean that when I'm cooking in front of the stove, I'm actually taking a shower?
No,
when the oil
really.
splatters on me when I
depends on which oil you're talking about.
So bath oils are really good. Whether or not you have eczema, consider trying out bath oil for your daily showers. That's what you're suggesting here.
Yeah.
Oh, okay, I go shopping later. Yes, I go shopping later. We are asking all to do about eczema today, and I just learned that it's actually more common than I realized. There are babies as young as like a couple of months already suffering from eczema. And you know what? Now it's making me think of the fact that my youngest one, Warren, before he turned 2, he would always get a bit of eczema on his arms. And we thought it was a food intolerance. Is that a common occurrence?
I really need to see the rash to know what it is.
Because we noticed that it would kind of pop up or flare, just little spots every time when he had strawberries. But after he turned 2, he was fine. So we were like, oh, maybe it's just kind of like, his body developing kind of a thing. That is one of the causes for eczema as well?
No, not really a cause for eczema. That sounds like food intolerance more than eczema.
See, this is Lavinia trying to be doctor here. Fail miserably, yes. We're going to jump on to Facebook Live. And remember, guys, chime on in, not just on our Facebook Live by commenting, but also you can WhatsApp in your questions as well. Great ones coming in, comments as well from everybody. Continue to do so, and you might just win for yourself a $100 voucher from Audio House. Now, they are the low price champions in Singapore for over 30 years. Go and check them out. Not only home electronics, okay, but they have groceries, even toys. You can head on over to their website and do some shopping right now, or even head on over to their physical store. It is at the Audio House building right above the Ubi MRT. Their website is audiohouse.com.sg. Join us on Facebook Live right now. Hey everybody, good morning. So the questions continue as we discuss about eczema, and you just shared with us on online that on air that bath oils is a good one to consider even for daily use, whether or not you're an eczema sufferer. And common misconception that people have is like, it's oil, it'll make me more dirty, it won't clean me, but it actually does a very good job of cleansing, but not drying out the skin, right? So there are cases of, I've seen this online, cases of eczema sufferers. And then they're going sort of like a cold turkey. It looks really intense. Steroid withdrawal. What are your thoughts on that?
Okay, so I feel like this has caused a lot of fear with steroids.
Yes.
Yeah, but the thing is that happens when you are using the inappropriate concentration for inappropriate amount of time, so inappropriate duration.
Meaning
so
that they're using too high?
And too long.
And too long? What do you mean by too long? As
so
in they've...
Normally, when we prescribe steroids, we will tell you how many times a day you can use it and for how many days before you need to completely stop.
Yeah. And steroids is one of the key treatments for eczema itself, right? The various forms as well. Of course,
because it brings down the inflammation really, really well. So it helps when there is an acute flare and the inflammation is all there. The breast looks so angry and red, and we just want to calm it down so that it's easier to maintain.
Okay.
But it's not a long-term solution. So you're not supposed to put it for a long time.
Okay, so it's really important when it comes to the treatment for eczema. If you are a steroid user, you got to make sure that you follow the doctor's orders.
Correct. I think we were just sharing when I was doing my diploma, the lecturer was just sharing that there has been no cases of these steroid withdrawals when the patient actually follows instructions.
Okay, that is a really, really good point to highlight here.
Yeah.
So all those really intense videos we see, they are taking these eczema sufferers, taking themselves off steroid usage. Their whole skin is peeling off and stuff like that. It's probably because they misused their steroids in their treatment. So they used too high a concentration and too much of it, and for too long.
Yeah, so it's always important when you go from one doctor to another doctor, if you're not staying with the same doctor all the time, you need to let them know about what your past steroids use was, because we wouldn't know.
We've got some great, I see, that's a really, really good point. So always check in with a professional. Don't listen to Lavinia as she tries to diagnose things. Got it? But we've got some really great questions coming in from our Brightside buddies. This one from Chua Chiao T. And he says here that, is it possible for eczema to resolve on its own when a kid grows older?
Yes, it is.
Oh, that's good news.
So, which is why I say infants 10 to 20%, adults 1 to 3. Because as we grow older, we're able to make a little bit more of the moisturizing factors that's needed. And you kind of grow out of it.
So that is something to monitor it. That's your point. When it's seen in the young sufferer, like little kids, monitor it. As long as it doesn't get really bad and out of control, there's a good chance that the child will grow out of it.
Depends on the genetics, honestly. But of course, keep moisturizing and everything. And as we grow older, our hormones change. And that will lead to the different oil productions and things like that.
Which brings our next question. This is a really good one from Josephine. Let me see. No, this is from Alicia. Alicia has asked, what brand of moisturizer would you recommend, Dr. Lynette?
Okay, so currently I'm with NYX, and we actually have this really good oatmeal cream.
I actually have it. And I also have your aromatherapy bath oil.
Yeah.
Which I really love.
Which also has oatmeal inside.
Yes.
Why we chose oat was because oatmeal is a very good natural anti-inflammatory and also a natural anti-itch. So then you can use these natural products on a daily basis to help to calm it down as well and keep your acute flares at bay.
I see. Okay, and I think you mentioned before, just to share with Alicia, that look for moisturizers with oatmeal, and I think it was
Ceramides, yeah.
Ceramides, right? Because these help to, what is it again? Retain the water?
Help to absorb more water and bring in more water for you.
Which is what the eczema sufferer's skin needs.
Correct, because you don't have enough of it.
I tell you, I learn something new every time you come in. Actually, I've learned a few things, Yeah, so, this one is from Wang Alun, who called you Dr. Brightside. This question is, how much is over moisturizing? You know, he says that sometimes I have this sinus issue. I can feel it's like really dry, maybe I think it's probably in the nose area. Should I moisturize it? Keep it moist?
Yeah, honestly, there's no such thing as over moisturizing, especially if you're having an acute flare.
Right.
Sometimes I tell my patients, especially the severe ones, I say just do it every hour on the hour.
Every hour. Wow.
Because it does help to just relieve the itch.
Okay.
It does help to calm everything down.
Okay.
Yeah.
So there will never be a chance of over moisturizing, right?
If you have the eczema flare, yeah.
Oh, wait a minute.
If you're saying like, for like you have completely normal skin,
okay,
and then all of a sudden you're putting a lot of the moisturizer on and things like that, then there's an issue, like, are you doing a bit too much, and then it gets a bit too cakey.
Okay, look for those signs.
Yes.
Cakey, that's how you know you might be moisturizing a bit too much. Or the handprints that are everywhere on your walls, your mirror, the door handles. I think that's when you're over moisturizing. We've got this great question. We're going to take just a couple more before we hit back on air. This one is from Yao Huat. And the question is, are there any foods that trigger eczema in kids? We may have covered this, but what's your answer to that?
There are, but it's not specific to like the disease in general. It's specific to the kid in general. So what I always say is try and keep a food diary.
Okay.
So then write down exactly what they are eating that day, and if they have a flare up. So then if you have like a few entries of when they have a flare up and what they have eaten, we can try and find something that's common and eliminate it from the diet.
And then narrow it down.
Correct. Because everyone is different.
Should the parents be doing this on their own, or should they really be working closely with their pediatrician or doctor or GP or something?
Honestly, it's better to be working with a healthcare professional, because if we're thinking about eliminating something from the diet, we have to think like, is the kid still having enough nutrients in other forms? Is it lacking some vitamins or something?
Right.
So then usually we do want to work with a healthcare professional who can explain, like, maybe this is too little, we have to replace it with something else.
Okay. So please always seek professional help. I got a great question from Josephine. She has asked, can home facial devices trigger an eczema attack? That is a very interesting question.
That is, okay. I have seen people who use devices or go for facial, and basically what happens is that they use an ingredient they're sensitive to, or there is an over exfoliation, something like that, and it gets their skin very irritated, angry, and then it triggers an attack. So it's not that the device itself has an issue.
Okay.
Yeah, that's what we need to know.
Point out. That's really good to be clear on. So it could well be maybe an ingredient that was used in the home facial. Always check back on that before you ditch the device, right?
Yeah, or you've gone a bit too high intensity.
Yeah, you turn the dial the other way, okay? You lower the intensity. But now that you mentioned about it, people kind of take for granted. You think like a facial device is going to help me, but it could very well, because of poor usage or the wrong usage, actually trigger an eczema attack.
Yeah.
Oh, okay. Again, seek professional help. We got time for, let me see now, one more question. This one is from Yen Liang, and the question is, are there any home remedies for eczema that are less costly? Oh, interesting question.
When it's in a completely acute flare, I think honestly at that time it's probably best to see a doctor.
Right.
But there are things that you can do at home to prevent the acute flare from happening.
Okay.
little things like no carpets.
Okay, that's
Try not to
interesting.
have carpets because the dust mites and things like that. So more of vacuuming regularly. Your
Right.
bed sheet can be the hypoallergenic, no dust mite free kind.
Bamboo fiber.
Correct.
Yeah, see, I'm learning.
Get a humidifier at home.
Okay.
Yeah.
Oh, that's interesting. We're going to jump back on air. Let's carry on with your answers to that question. I like this question from Yan Lien. So let's jump back on the bright side on 1FM. I'm starting to suspect the playlist knows exactly what's going on in the studio because that was Celine Dion's with, and that's the way it is. As we're talking about eczema here on the show. So it's all about eczema with Dr. Lynette Yap, general practitioner, and also with special interest in dermatology and aesthetics. She practices over at one of my favorite clinics, NYX Professional. You can check them out at nyxpro.com. And we had a great question from Yen Liang, and the question was about home remedies for eczema. Are there any of those that are less costly? And you say it's a lot of just small tweaks that you can make to your lifestyle, from taking away carpets or at least cleaning your carpets more often. Carry on with that, yeah.
Or like say having a humidifier turned on, washing your sheets and your clothes in above 50 degrees Celsius.
And also the type of bed sheets you use is important too, right?
Yes, the type of bed sheets. You need the hypoallergic ones, the ones that prevent dust mites as well.
You know, Dr. Lynette, you shared with us on Facebook Live, and I thought this was a really interesting point because it really stayed with me. Clothing can actually trigger eczema. And sometimes maybe you've got like your bamboo fiber clothing, which is hypoallergenic, but the clothing tag might also start an eczema attack. So sometimes you got to look for clothing where the tag is outside.
You can cut off the tag
cut
as
off
well.
the tag,
but it's just that I'm not sure if you noticed there is a trend in baby clothes whereby the tag is outside.
Oh, so that is why.
That
I used
is
to think
why.
why they put it outside.
That's the reason why.
Now boom. So just to quickly summarize, I mean, this is a really great chat. You've really gone in depth about the causes of eczema, the possible treatments. When do we start looking for treatment and all that? Can we just have some really good takeaways about, this whole skin problem and issue with eczema? How about starting first with steroids, that honestly, we don't have to be scared of steroids?
Yeah, so like I said, that steroids, honestly, it's the cornerstone of calming down eczema when it's in an acute flare. And when used appropriately at the right amount, the right duration, the right concentration, it does not have any side effects.
So we won't have those scary things that we see, those videos of like the steroid withdrawal and the whole skin just peeling off. They're like reptilian and all that. So none of that. That is because of wrong usage.
Correct.
So from there, you also say that's why you need to go to a professional to get it diagnosed properly, because there are many types of eczema, right?
Yes, there are so many types of eczema.
Really? What are we talking about? In the hundreds? Thousands?
And the tens.
Okay, not so bad.
But the severity is different for every single one of them. There's mild, moderate, severe, and all of it has its different triggers. All of it has its different treatments.
Right. And it's also interesting, like you point out, that a lot of it has to do with lifestyle, right?
Yeah.
What triggers the eczema, and also stress.
Stress does trigger eczema.
How badly? Like, do you see a lot of cases? And how do you treat stress when someone comes in as like the eczema is bad, and you're like, you can tell she's obviously looking stressed. Do you like put on some nice music and like, come, let's spend some time together, talk to me?
No, so I mean, of course, I treat the skin itself by moisturizing it more, as well as giving some treatment medications to help to calm it down.
Right.
But I always explain that it's actually due to stress more than anything else. I think I have a few patients with eczema now who are all undergoing A levels. So then all of it has all flared up.
Oh no.
Because they just finished their mid-years.
And the only way around it is they have to manage your stress,
Yes.
or just go through the period, and hopefully after that, when they're done with their exams, hopefully the attacks would subside and the eczema kind of calms down.
Yeah, but like there are ways to obviously help to de-stress, like do some deep breathing exercises, yoga, meditation.
Okay. So do all of that and try and find out. I guess your advice is really, if you notice it, seek professional help, and also start to take note of what you're doing, what you're eating, and hopefully you can find out what triggers your eczema, because it's very patient specific.
Yes, it's very
right?
personalized.
Well, thank you so much for joining us here today. And of course, if people want to catch up with what you're doing, and you actually have an Instagram, right? Where you actually focus on what you're passionate about, skin, dermatology, aesthetics. Where can we find that?
So it's just my name. It's under Dr. Lynette Yap. And I am also doing a whole series on eczema now.
Really?
Yes.
Perfect. Guys, okay, we got to go and check that out. Thank you so much for joining us here today.
Thank you.
The Brightside. Good times. Greatest hit.
Facebook Live with Dr. Lynette Yap. We just want to thank her once again. And can you just share with us, where can we find you on Instagram for everyone on our Facebook Live?
Okay. So my Instagram handle is Dr. Lynette Yap. So that is one N and two T's.
One N and two T's.
Because there's so many different ways of spelling.
That's true. And you mentioned about how currently you're doing something very related to what we discussed here today.
Yes. So currently I'm doing a whole series on eczema. Yeah. So I push out every Monday and Thursday, and it's going to be a different part of eczema each time.
Wow.
Yeah.
Okay, this will be very interesting, especially now that I know how common this skin condition is. And at your Instagram account, with what you share, might we find the answer to this question? Okay, from Joanna. She says, "Hi, good morning. Can you ask Dr. Lynette, what's your take in fillers for a 50-year-old self?" Like herself. Wow. I think you just go to Nick's Maple Clinic.
Yeah, I was going to say, there's so many kinds of fillers. I need to know which kind you're talking about as well.
And also, is it another thing where it really is about, the individual and making sure that's the right one for them.
Correct. And what is the image? What do you have in mind at the end of the day? Because fillers might not be the one
right
that's
thing
best
to help you achieve what you want.
Yeah, because we have so many things now as well.
Because sometimes we think we know, we think that's what we need, right, to achieve what look we want. So Joanna, please go and check her out. Okay, nixpro.com. Head on over to the clinics. Not trying to sell it, but it's true that it's best to seek professional help because they are in the know about what needs to be done and how to do it. Okay, thank you so much, Dr. Lynette, and we'll see you guys back on the bright side, all right?
Thank you.
Good times. Greatest.